It's another segment from the health team from PALF Foundation. And before, we would want to thank you for your support you've been giving to the organization. We say God richly bless you for all you've been doing for us. So we kept on saying that probably every month or every week we're going to bring you a health segment. So someone requested that we say something a little on diabetes. So that's what we'll be sharing on. We didn't go deep in it, just a little shallow of it. So somebody would ask, what is diabetes, or what is diabetes mellitus? So diabetes is a group of metabolic diseases. That is when the body is unable to convert the glucose or the sugar in the blood into energy to be stored in the cell. So that is basically what diabetes is. Somebody will ask, how does diabetes come about? So what happens is, as an individual, as a person, when we eat, the food breaks down into sugar or glucose. And when it is much in the system, the body is supposed to process it into energy or glycogen, which will be stored in the cell for energy. Or when the body needs it, then it's being reconverted into glucose for the body to use. But then we have some persons, or in certain situations, the bodies are able to convert this sugar or glucose into the energy for the cells to store. So it freely flows in the blood, making it become too much sugar in the blood when it's being tested. So that is diabetes, too much sugar or glucose in the blood. Initially, it used to affect the elderly persons, but now even babies or kids or the young adults are being affected by diabetes mellitus. So what causes diabetes? There's no actual cause, I would say, but then there are contributing factors, probably maybe genetic or family hereditary, maybe poor dieting. Most people who eat this salty and spicy food or takeaway food, being overweight, not managing your weight, then maybe not regularly exercising their body, sometimes from medical conditions, overuse of certain drugs as well, or maybe when there's a tumor of the pancreas where the beta cells produce the insulin, and other minor contributing factors. So those are what brings about diabetes. And in this diabetes, we have various types, but today we are going to talk about the 3 types of diabetes for this day. So we have the type 1 diabetes mellitus, we have type 2, and then the gestational diabetes. So that's what we talk about. So we are taking type 1. The type 1 diabetes mellitus is also known as the insulin-dependent diabetes. So in this case, these persons with type 1, which is insulin-dependent, their system, or let's say the cells, which is the beta cells that produce a hormone called insulin, these persons are not able to produce the insulin, and this insulin acts on the excess glucose or sugar in the body, which helps to convert it to the energy or the glycogen that is being stored for later use. So these persons, their cells aren't able to produce the insulin. So what happens is, when they take in the food, the glucose or the sugar freely moves in the blood. So the insulin, which is not produced, does not work on it. How is it that the insulin is not produced? Maybe they have certain medical conditions or family genetic deficient, or maybe certain factors that have affected, or tumors which have affected the pancreas that produces the insulin. So that is what type 1 is about. The people here are unable to produce that insulin, or maybe sometimes to their own body system attack the cells that produce the insulin. So it's the insulin here that converts the excess sugar or glucose into glycogen, which is stored for energy. So how do we treat these people? We put them on insulin therapy because they can't produce it. We give them injections, they are injectables that we give them insulin therapy. They are being taught how and where to use it, so they can take it home and then they inject themselves, so that through the injection they are able to have the synthetic insulin that will convert the sugar into the energy or the glycogen for later use. So that is type 1, the insulin dependent. So they solely depend on insulin every time and always. Then we move to the type 2. The type 2 is mostly the common one, and also mostly affects the older generations, even the younger one as well. So with such persons, they are able to produce the insulin all right by the cells, but then they lack this receptor that is supposed to help the insulin convert the glucose into glycogen. So the insulin is there all right, but it just moves freely in the blood cells with the excess sugar or excess glucose, and it's unable to attach itself to the glucose to convert it. So it just moves freely. So that is how the type 2 also comes about. They are able to produce the insulin. They are fine and fit to produce insulin, but the insulin doesn't work because the receptors are supposed to act on the to help the insulin act on the excess sugar, doesn't do so. So these persons as well, they also put on other drugs that makes the insulin or the receptor sensitive, so that it converts the excess sugar to be stored. Then we move to the third one. We are talking of the gestational diabetes. So gestational diabetes comes about when one is pregnant, that is during the period of pregnancy. We have people, maybe their hormones are so excessive that it makes them to develop such diabetes. So those persons, when it's being detected, we monitor them. They also put on drugs. Sometimes they are being admitted and then observe over time, because it has an effect on the fetus as well. Sometimes it can cause abortion, and sometimes the baby grows too big. The baby needs to, so in this case, sometimes the baby needs to be delivered before the baby gets to term. But the good thing about it is, when the person is done delivery after, but sometimes it resolves naturally on its own, but we still keep to monitor the person so that there are no complications of it. So this is generally about diabetes. We have complications of diabetes. So what are they? Sometimes it processes to kidney problems, cardiovascular problems, and any other complications that it relates to. So for now, this is what we would talk about. Probably the other things about diabetes we'll still go in details about. So this is where we end. If you have any question, anything you don't understand, you let us know. If you have any topic as well you still want us to discuss, you let us know. Anything medical, surgery, or ops and gynae, you let us know. So thank you for listening, and thank you for being a part of us.